Today's topic, early childhood decay and sippy cups. So roll that intro and let's get into it. What's up everyone, Dr. Eric Jackson here. Hope you're all doing well. Today, like I mentioned, we're going to talk about early childhood tooth decay and sippy cups. It may come as a surprise to you, but tooth decay can appear as soon as the teeth erupt through the gums. I've seen it. I know all my dental colleagues have seen it. In addition, you're also going to have other issues such as rings of tartar and calculus around those two baby front teeth that just when they poke through. We have to start taking care of our teeth, our children's teeth, right when they erupt. We have to be prepared for it, which is why the modern recommendation is to have your child seen by a dentist between the time of eruption and before their first birthday. It's a very important time to learn a lot of these things, which is one of the reasons I have the YouTube channel, to kind of give you a head start and discuss with your dentist then more specifics on your child, or your mouth for that matter. So, there's a lot of risk factors with children. I mean, kids love sugary food. I mean, adults do too, I suppose. But kids love sugary food. And it's very important that we try to limit the frequency and the duration of the sugary food in the teeth. If we're always bathing the teeth in sugar-containing food, or sugar-containing drink rather, it's just ripe for problems. Everyone always, obviously, goes right to juice. Too much juice, too much sugar, and that's very true. You can cut the sugar. You can cut the sugar down by adding water to your juice. But also, don't forget, even milk has sugar added to it for the most part. Most milks do. So it's something to be really concerned about. And what's the best drink out there? Well, good old-fashioned pH balanced tap water. Here in Chicago, we have some of the best water out there. I think it's tasty. It's nearly free, and it really benefits our bodies and our mouths and our oral condition. So when your child's making a transition from baby bottle to training cup, right? Well, what are we looking for? Well, we're looking for a bunch of bullet points, right? What kind of cup do you choose? What goes inside the cup? How often will your child be sipping from it? And will you allow the child or not allow the child to carry the cup around with them? These are all four very important aspects that we're going to discuss right now. So let's talk about selecting the correct sippy cup. And let's talk about the word sippy cup there, because we want them to be able to sip, right? It's not suck. Baby bottles are sucking, sippy cups are sipping. And the problem is that, I mean, I've got 4 kids. I know that, kids are messy, right? You want to select a sippy cup that doesn't have a no spill valve, right? It should be able to spill. That's the best out there for the teeth. It's the best out there for the orthodontics of it all. We don't want to have a sippy cup or a training cup that is basically just a baby bottle in disguise. Something that they have to then hold up and suck from, because it is so leak proof or so spill proof that basically it's not really a cup at all. It's just a different shape of a baby bottle. So selecting the right cup, we want to avoid those with no spill valves, right? An actual cup, perhaps it has a lid, perhaps it has a device of some sort, of course but ultimately, if you were to tip it up, maybe it does spill a little bit, and that's okay. It's going to teach your child to sip as opposed to suck. It's going to keep their teeth from becoming misaligned and malpositioned further than they should be, and overall just help minimize a lot of the dental risks. Now, a lot of these cups that lack the spill proof, the valve, actually have a weighted base to help compensate, because it's not just a cheap piece of plastic cup. It has a weighted base, so that way it's going to sit upright more likely. Or some of them are even like Weeble Wobbles. If you remember those, they won't really fall over. It'll kind of just self-right itself. And you might want to look for those kinds of features as well. All right, so number 2, we talked about what goes into the cup. We briefly touched on it, and we're going to say ultimately water, right? We want to have water. It's pH balanced. It's calorie free. It's sugar free. It is the best possible way to hydrate, especially for a young child. I know it's not the most flavorful nor the most delicious for a kid, so you're going to have to pick your battles. Coming from a parent, I can tell you it's all about picking battles, obviously, but ultimately it comes down to, milk was our go-to in the absence of water. We really didn't give a whole lot of fruit juice, and certainly not with any real frequency. In a perfect world, you're offering these drinks at mealtime, right, or snack time. Now, kids, they eat smaller. Often they eat smaller and more frequently than adults do. But with that said, we want to avoid the constant bathing. Like we said, it's the duration and the contents of the liquid. So if we can minimize the time on the teeth, it applies to adults too. We don't want to be sipping on sugary drinks all day long, consistently lowering the pH of the mouth, consistently lowering the pH of the saliva. That is what causes a lot of dental problems. Being able to drink your beverage, get it in, get it down, and then allow your saliva to naturally, flush away the sugar, balance the pH, lubricate the mouth, really works out well. There's a lot of great studies on how long it takes a mouth to become pH balanced again after a specific beverage. For example, there's a lot, and you can do Google searches on this, but there's a lot of studies on, for example, how long after a glass or a cup of coffee, how long after an energy drink, how long after a Diet Pepsi. Those kinds of things are all quantified in these types of studies. And it's very, very interesting. By the way, spoiler alert, the energy drinks take a surprising long time for the pH of your mouth to rebalance, as opposed to the coffee, or even the Pepsi for that matter, which does actually normalize pretty quickly when compared to the energy drinks. So we talked about some tips about what kind of training cup to use. We talked about what goes in the cup. We talked about how often the child drinks from it. And then the fourth thing we want to talk about is, will you allow the child to walk around the house or walk around with it and carry it around or not? And the answer that kind of lumps into the item 3 there. We don't want to have unrestricted access, 24/7 access to this. It's not a security blanket. It is something that you want to use as a mealtime or snack time tool, because that way it's not consistently bathing. Now, if you want your child to, if it's hot out, summertime and whatnot, and you're going out for walks in the stroller, or you're at the zoo or something like that, you put it in the stroller. That's what everyone does. That's what we did too. But try to keep it sugar-free content. So it's all about a balancing act, right? So if you're going to be drinking a lot more beverage and you're going to be having a lot more contents being consumed with a child, really try to make sure that that's a pH balanced, sugar-free item like water. And so all these things kind of work in synergy together if you really kind of think about the logic and plan it out. There's also the physical aspect and the physical danger of walking around a toddler, a child who's learning how to walk. They fall a lot, obviously, and depending on how they fall, if they're holding an item, a soft blanket's not going to be as big a deal. But ultimately, a hard training cup, a hard sippy cup is going to be potential danger if they fall on it the wrong way, fall in their mouth, onto the cup, or fall with it in their mouth. It can be actually quite devastating. I'm not terribly pro candy, obviously, but I always use the same thought process when it comes to a lollipop with a stick versus a ring pop. Having a child walk around with a lollipop on a stick, especially a toddler, but it can be any real young age child. It kind of gives me a bit of anxiety. I don't like it very much. I try to have, if we do give those to our children when they were younger, we want to have them sit down in a chair or something like that. You see too much danger, too many accidents that just kind of happen from a trip and fall, and all of a sudden there's something in the mouth, and it can be very devastating, as opposed to like a ring pop or something along those lines, where it's not being housed in the mouth, they're not walking around with it in the mouth, and it's a little bit less dangerous for that reason. So apply that same logic to the sippy cup, the training cup. Well, if it's not in their hand, if it's not on their person, well, then they can't really fall on it, right? And so being able to take control of that also plays into the entirety of their conversation. Above all, we have to remember that these are training cups, right? We call them sippy cups. We call them tippy cups and a bunch of different names, but they're training cups. They're training a child to go from baby bottle to open lid cup, right? It's a transitional device. And as the child progresses with their hand motor skills and their balance and whatnot, they're supposed to leave that phase. And so overall, the goal here is to get into an open cup as soon as predictably possible. Every child's different and every situation is a little bit different, but ultimately we want to make sure that you're using the tool properly to train them into a regular cup, because that's really where the final result should be. We want to have all this kind of come to the final conclusion that you're graduating to a big kid cup. I hope all these concepts resonate with you. There's just so much theory behind this that, it's often overlooked. Much of parenting is that way. The why behind the things that you see, and when you walk down that baby bottle aisle and then you walk down the training cup aisle, it's really surprisingly endless. There are so many different types: the valve, the no valve, the spout, the little lip, the circle one with the thing. It's a lot to digest. So these concepts hopefully will help you navigate any products that are in your personal aisle, in your store, down the street, or online. I hope it helps a little bit for you too, because it doesn't have to be overwhelming, put it that way. Thanks for watching. I really appreciate it. These videos are great just to kind of get good concepts like this out there, being able to share it. So please go ahead and share if you have any young parents that might benefit from seeing this video. Of course, questions go down below anytime you want. I appreciate all the feedback we always get on the channel. It's always very nice to hear back from people who are watching. Thank you for watching. If you liked it, give a like, a thumbs up like, and then of course subscribe to the channel. And then I'll see you in the next video. Bye-bye now.